Well, it's important for schools to have a speech-language pathologist because oftentimes we have kiddos that have language delays or have articulation delays, and it limits their ability to access their curriculum.
There's so many things that we work with, articulation, language, stuttering, and voice. Those are the 4 performance areas that we look into.
Math is language-based, reading is language-based, and so that's what we help them with also too, to get a good foundation and to be able to excel in those academics.
So if you're in the schools, you have this huge influence. You get to see them most of the day. You get to see all the places they communicate. And a speech pathologist can go in, study what they have to understand academically, pick out why the child can't do their best. There could be something in their language, something in their speech. They can give those kids the tools.
There are a lot of students with disabilities in the school setting that require intervention in the area of speech and language. In fact, 25% of the students that are eligible for disabilities in the school system are students with speech and language disorders.
Well, schools definitely need speech pathologists to address the needs of certain kiddos that might have specific learning disabilities, difficulties with articulation, speech sound disorders, really to be there to support a classroom teacher. So classroom teachers are now becoming a lot more aware of our abilities and are more receptive to us coming into the classroom, and so we start seeing our caseloads kind of skyrocket.
When we have a student that's suspected of having some disability, we have maybe the school psychologist, maybe a special education teacher, maybe a speech pathologist, all working together to try and really sort out if the child is eligible for special education and what their areas of need might be.
So we're always collaborating. Being a speech-language pathologist in the schools, you have to be a collaborator. You work with so many service providers and you have to be flexible, because bottom line is we're working to make sure that these children are accessing the curriculum.
So if an individual is having difficulty communicating their wants and needs and others can't understand them, if the teachers can't understand the student, that impacts their self-esteem too. So we help them on so many different levels.
We are really in the schools to help kiddos access their curriculum. And the great part about that is that we can really help kiddos do better in terms of accessing their curriculum, interacting with their peers, understanding their teachers' expectations. And we have some skills that help kiddos know how to ask questions differently, how to get help differently, so that they can be more successful.
When the parents told me, it says, we were at a drive-through and my husband was saying, can you get him to keep quiet for a second? And I looked at him, she said, and said, do you remember a year ago we couldn't even understand what he was saying? And you're asking me to tell him to be quiet? He goes, you're right, this is great. Suddenly a father can have a conversation with their son, and a mother can have a conversation with her daughter. That's gold. We give them confidence in the ability to communicate. We allow them to unlock the keys to communication. And it's a gift that rewards both the provider and the student. I think as a speech-language pathologist, what we give to the students is confidence. Confidence, the ability to communicate more effectively.